Try to talk a little louder. All set? Okay. Hello, good afternoon, and welcome to the third annual State of the Agency Address. I appreciate your attendance, and for those who could not be here, a video and transcript will be posted on our website and internal SharePoint site so everyone gets the same message. I apologize, I'm a little under the weather, so I'm going to try and not cough, I'm going to try and not choke, and hopefully you'll be able to understand me. So, and I'm not contagious. Well, 2018 was another good year. We accomplished many great initiatives, and we've had a lot of positive things happen throughout the agency, but there'll be more on that later. As you know, in April, our Board of Health approved the inaugural strategic plan, and since then, the teams have been working very hard to complete their initiatives. We have 5 teams: workforce development, internal and external communication, data and communication, sustainability, and transition to the new building. So let me tell you a little bit about what these initiatives are and what these teams are working on. So workforce development is working to develop a standard onboarding and orientation procedure for staff, creating a program that outlines and provides agency-required training and education, and develop a professional development plan that provides opportunities for skill enhancement in our jobs. The internal and external communication group is getting the information out to our partners, etc., on the strategic plan. They're working to improve our level of communication throughout the agency and community partners, and provide our clients, patients, customers an opportunity to provide feedback to us on our services and our level of customer service. The data and communication team is completing an inventory of all available agency data and developing a data warehouse to share this data with our partners for their use as well as ours. Now they've got 2 initiatives, but those are huge. Sustainability. Developing a sustainability framework and then applying a sustainability tool to assess our organization's programmatic sustainability. So what does that mean? Basically what we're trying to do is make sure that we decide on the right programs, provide the right programs, and work in a way that will sustain our agency and those programs. The transition to the new building, they're planning for the actual physical move to the new building, developing a logo and brand for the agency, and developing or revising policies and procedures as they relate to the new building. In the next couple of weeks, the committee will be sending out a survey to all staff, as promised, to pick an agency logo. There are 3 finalists, all wonderful artwork, but as promised, staff will make the final choice. The logo will be used in a branding campaign later this year and will be the symbol that the public and our community partners will associate with our agency. Letterhead, envelopes, forms, flyers, social media, website, everything and anything that has that boring Will County logo on it will now have our beautiful Will County Health Department and Community Health Center logo, okay? So that means participate, vote, get the word out, see what you like, and make your choice. There'll be 3 finalists that'll be going out, and you'll get to make your choice. This is yet another example of an opportunity that most people don't even get to participate in their career. The new building, I mean, we're doing a lot of great things here, so please take the opportunity to participate. It's really pretty cool. The plan, the strategic plan is a 5-year plan, and we have ample time to complete the initiatives. And I'm very confident we will be able to complete all of the initiatives within the time frame. The Board of Health will be reviewing and discussing the Q3 results at their meeting next week. And after that, I will post the document on the SharePoint site for all of you to see and review and just get an update on where we're at. As I mentioned, one of the teams is working on sustainability. I spoke of this during last year's address, and I will tell you that we continue every day to look at ways to be more sustainable, to streamline processes, to be cheaper on things as far as how we purchase and and just trying to find ways to be more efficient and sustainable every day. If you have any ideas or questions, please forward them to your division head. I would love to hear them. Please remember our core values of integrity, respect, professionalism, quality, and dedication. I'm going to reminisce a little bit here and repeat what I said last year. What does that mean for you and me? It means that we are building a better place to work, a place where our clients, customers, and patients want to come. It means we are incorporating into our work life many of the positive values that we hold in our personal lives. It means that we show respect to each other, to our clients, patients, customers, vendors, other county personnel, everyone we encounter. It means that we act with integrity in all that we do, that we're truthful, upright, and reliable. That we act in a professional manner at all times with each other and everyone we encounter. We all represent this agency and therefore represent each other. Present yourself well and be someone that is a positive representative for the rest of us. It means that we dedicate our 7.5 hours per day to our clients, patients, customers, and the residents of Will County. We hold a job in a local health department, a unit of local government, and we provide some very necessary services to our community. Dedication to services results in great services. And lastly, it means that for the services we provide, we will try to do our best, that they be of the highest quality. My hope is that you all see value in this and help me help you make this a better place to work. The Employee Engagement Survey. The Employee Engagement Survey was distributed again in 2018. The survey was essentially the same as last year except for removing the neutral answer from the choices. That choice was not helpful at all in looking at the data. The number of respondents in the 2018 survey was a little higher than in 2017, which is wonderful. My hope is that every year we have more staff responding, not only to the closed questions, but also to the open-ended questions and the opportunities for all of you to comment. We received more comments this year also, which is improvement in our communication, another great thing. As was done last year, the results of the survey will be made available to all staff, and the leadership team will be meeting to determine what additional goals we need to work on in 2019. A sincere thank you to all who participated in the survey. New building update. As you can see, the building construction has begun. I will tell you, today is like the first day it really feels like a construction site to me out there. I mean, they're digging big holes and it's just wonderful. They've got this big backhoe right in front of my window, and every time I walk by, it looks like a dinosaur standing there. But it's so cool to see. I know it's not without some pain, though. The parking shuttle can be a hassle, and you may not be able to navigate the campus as you're used to, but it will be definitely worth it. I keep saying, keep your eye on the prize. We don't have a whole lot of time that we have to go through this, and it'll be well worth it. At this point, all 3 bid packets are out, and 2 out of the 3 have already been awarded. Many of the decisions for the interior of the building are still being made, and we have not looked at furniture or office equipment, nor have we made any final decisions on carpet or wall colors. We are meeting with Kluber Architects next week on January 23rd to move forward, following week, on January 23rd to move forward on some of these items. Outside, they will be doing groundwork for the next few weeks and starting on the building pad. Once that is done, they will continue to dig out the pond. Of course, depending on weather, these schedules may change. In the next week or so, a camera will be installed, and it will be a live feed, and we will be able to provide you with a link to look at the live feed on your computer. And of course, that will be even better for the branch office staff because they can stay closer to the progress. We can smell the dust over here. Thank you for all being patient and understanding about the parking shortage. It is truly appreciated. Don't forget, Tuesday, February 5th at 1 p.m. is the groundbreaking ceremony. If you are able to join us, We are planning on being near the construction trailer for the ceremonial shovel dig, then going into the warm building for some light refreshments. It'll be here in this part of the building, this room. Budget and finances. Every year I share with you the status of our finances and our budget. For fiscal year 2019, our budget is $28,387,235, an increase of less than 1% from last year's budget. In fiscal year 2018, we increased some user fees throughout the agency. We also expect some additional revenue from new grants and expansion of some of our programs. We are also seeing some payments still coming through as a result of the state of Illinois budget woes. They're still working through some of that. Overall, we expect to collect more in fees, grants, and can expect the same $10 million levy contribution from the county. Last year I told you we were working with the county to consolidate some expenses by centralizing services. We have begun to do this, and in this year's budget, our current budget, we were able to remove over $200,000 of expenses that now the county's facilities management are paying for through the county budget. We plan to continue this process and have identified several more budget lines for next year to consolidate as well for more savings in the fiscal 2020 budget. As long as we receive the proposed revenue and our funders do not eliminate programs, we should end the year just fine with no cuts. Remember, approximately 84% of our expenses is all salary and benefits. That means we only spend about 16% or about $4.8 million on everything else, So we really do a good job in trying to keep our costs down. We will continue to search for ways to spend less, streamline processes to become more efficient, and also to improve our revenue collection. Our goal is to always over-collect and underspend. Stabilizing funding means stabilizing jobs. I'd like to highlight just some of the accomplishments from 2018. There are really too many to mention. We would be here till tomorrow. And I really had difficulty doing this section because I feel that I'm always leaving something out. I mean, we work really hard here. Everybody works hard on so many initiatives throughout the year. If I don't mention something, I feel people will feel bad that I didn't think it was important, but that's not the case. I just put down some of the things that come to mind, review some documents, but we do so much, I can't even list it all. But I'm going to go through some of these things just so you have some understanding. In administration, we did a total website restructuring. If any of you go to the website lately, I mean, we still need to do some additions and some tweaks and some corrections, but it is so much simpler, it is so much cleaner than the last one was. It's not so difficult to navigate, and a big component is that it's much easier for our staff to put information on the website. So things are going to be much more updated. We are continuing the remodel of the North Branch office to include all divisions. ITT implemented an e-fax and the consolidation of multiple function printers. They did many infrastructure improvements throughout the whole technology within our agency. They did a network upgrade at MBO, just a lot of things. We had a very good and successful promotion of our National Public Health Week. And Steve's done a lot of senior community appearances throughout the county, showcasing our programs and education. A lot of times we forget about our seniors, but they're a population that we have to serve, and we're doing that. In EP&R, they hosted several wonderful trainings for the emergency response team. They planned and executed several drills for their grant deliverables. They collaborated with our MAP program in securing the grant that funded several mobile food pantries that fed hundreds of families throughout the county. They provided both CPR and Stop the Bleed training. They hosted and facilitated another Operation Santa Drop that sent 16,603 items. Who counted all that? To troops in Bahrain, Afghanistan, Japan, Kuwait, and a naval ship somewhere in the South China Sea. It's very appreciated by our servicemen and women. In EH, they revised their food safety ordinance to include raising some fees and have been gearing up for the change that took place January 1st to the new FDA food code. That's not a lot being said, but there's a lot of work involved with that, a lot of retraining, a lot of new technology. So they've been working on that and have done a very good job. They did a revision of their swimming pool ordinance. They are constantly tracking and sometimes responding to outbreaks and product recalls. This year, I don't know, Tom, it seems like it was a record year. You guys were dealing with E. coli, Listeria monocytogenes, Clostridium, norovirus, I don't know.
On and on.
Huh?
On and on.
Yeah, on and on. So, again, a lot of time is involved with that and staff dedication. Behavioral health, they enhanced their use of their electronic billing system to now include medical records. Big change, big initiative. They did an extremely quick rollout of the mobile crisis program. They were notified with very little time frame that our SAS program was now going to be lifespan model, which means they're not just treating and responding to kids, they're responding to everybody, anybody, all ages. We received a formal recognition of our clinical training program by Adler University. We received the Excellence in Supervision Award. And they're working closely all the time with the County Executive's Office in community education and advocacy regarding the opioid overdose epidemic. The Community Health Center, Bolingbrook is now a family planning site, yay. They've expanded fully their behavioral health services in the Community Health Center. They received a substance use disorder and a medication-assisted treatment grant. Both brought in a lot of money. We're able to hire some new staff. They have begun training and now are doing trauma-informed care, which means that they're looking at what we call ACEs, adverse child experiences, and how they affect people. And you know, there's a whole different way you can approach patients by understanding that. We conducted a survey of the residents and businesses in the eastern part of the county for interest in the possible expansion of primary care services to the eastern branch office, which we are going to be doing. So, and again, more and more. I mean, there's too much to list here. In Family Health Services, they're putting on a very successful PrEP clinic in conjunction with the Community Health Center staff. They were also received additional grant dollars so that we can do some more outreach in our tobacco control and prevention program. Staff were instrumental in placing a micro pantry on our site, which has been used to the fullest. I mean, that thing is empty, full, empty, full, empty, full. And so that's a good thing. Well, a bad thing, but a good thing that we're doing. We received continued funding for the extremely successful Teen Pregnancy Prevention Grant, and we did have an ending with very successful C-Dash grant that directly impacted 10,700 employees, 8,301 students, and 294,757 hospital patients in the county. Pretty cool. As if that wasn't enough, Will County reached being in the top 10 healthiest counties in Illinois for last year. We reached that for health outcomes, which means the quality of our life, the length of our life. It's an improvement up 2 spots. We were previously in 11, we're now 9, we're in the top 10. So that's great. You need to know these things because you need to know that what we do does impact the community. So I'm very proud of that and all the work that you do. Okay, let's talk about 2019 and some of our goals. We're going to complete the expansion of our primary care services from the health center to EBO. We're going to continue to enhance our advocacy efforts on what public health is and what it means to the community. When we do our logo branding campaign, we're going to have a good opportunity to put a lot more information out there with that. I'm going to continue to do my best to facilitate the construction of our new purpose-built building, and I'm going to continue to unsilo the agency. It's working. I once again thank our Board of Health for all their support and guidance. The agency is really fortunate to have an engaged and dedicated group of professionals working with us and caring about what we do every day. The Board of Health meets every third Wednesday at 3 p.m. in this building. It's an open meeting. Anyone who wants to attend, come on down, see what it's like. It's kind of cool. I remember, you know, when I was line staff, I would come to a couple of them just to see what was going on. So you're welcome to join us. Thank you, staff, for all the work that you do. I firmly believe we all contribute to the success of this organization, and every one of our jobs is important. Thank you, managers, for your unending contribution of time and extra efforts. That is noticed and appreciated as well. Please hold yourself accountable to provide the best services we can to the many people that need them. Thank you for your attendance, and I look forward to another wonderful year. Any questions? Thank you. Any questions? Oh, come on. You know, I'm fine with answering questions. It was just so informative.
Projected occupancy date for the new building.
Okay, good question, Joe. We are looking at what they call substantial completion in June, probably end of June, early July 2020. And that's when we're going to have to coordinate the moves. We're not sure yet. This is, you know, far-reaching here, but probably is going to be a 2-weekend move. We can't do everything in one weekend. And as you know, we have to be operating as we're doing all this. So June, July, and then what they call, project completion in maybe December or November of 2020. And that means that once we're in the building, now they have to come in, they have to, you know, clean out this building and, you know, get it ready for demolition, demolish it, clean up the site, and then put in the parking lot. So just, you know, there's a few months left after the move. Yeah, Val?
I noticed they're digging pretty far down out there.
Yeah.
Are they gonna level the whole campus eventually?
No, well, you know what they do is a lot of times they'll go in, and I'm by no means a construction, you know, guru here, but a lot of times what you find out is they level things and then they go back in and then they'll, you know, build it up in different areas. But yeah, it won't be, you know, flat. It's not gonna be what it was before, but yeah, it'll look different.
Okay.
Yeah. I guess the pond area, which is on the other side of the ring road, they have a little more water in it than they anticipate. And of course, it rained for a couple of days when they were gonna get ready to start excavating it, so that was a little bit on hold. So, yeah, Cindy?
That's what I was gonna ask, is where's the pond gonna be? Because I knew they were digging a retention pond.
Yes, it's gonna be on the other side of the ring road, and, you know, I thought the trees were thicker. You know, when they took out all those trees, now you can see who's on the other side of those trees. I thought we had more space, but we don't, but that's okay. It's, you know, it's still our property, and we'll still have a backdrop. I commented to the facilities director when we met earlier this week that when this is all said and done, my goal is to plant more trees. We have to see, you know, how it shakes out, but I want more trees back on the campus. And it's gonna take a long time, and, you know, the people that are here long after I'm gone can enjoy them, so. Yes, Gail?
Will everything be replaced and new in the new building?
Pretty much.
So are we going to recycle any fixtures or materials to the community, you know?
Absolutely. Yeah, oh, to the community?
Or, you know, to
I thought you said community
donate?
health center.
Yeah.
Because Dr. Bird and I already talked about, you know, there are certain things in this
Chairs.
building, like these chairs,
Yes.
that are perfectly fine, they all match. You guys could have in your building. You guys will have first dibs. But we're meeting about the furniture, the office furniture and equipment on the 23rd, and that's when I'm gonna get a really good idea of what's gonna be included. According to the architects and my discussion with him last week, it looks like the bids came in pretty favorable, so that we aren't gonna have to bring the old bookcase in with the new furniture. Now, that being said, I don't wanna get rid of perfectly good cabinets and whatever, file cabinets, because we will still have a use for that, even in the new building. Maybe in a storage room where we need to store files that we have to keep, we can't get rid of them. But they're not gonna be where it's with our nice new furniture. So some of that, everyone's worked on their equipment lists for the whole agency, for the whole building here. Every single room, we know what's in that room, and we are gonna be meeting, myself and Elizabeth and Pat Thorne, we have to figure out a process, because we literally have to go room by room and go, yes, no, yes, going, recycle, surplus. We have to go through all of it, so. I mean, you guys will get first dibs. And as far as the community, we can't, I know that some people want us to have like a garage sale or whatever. You would not believe the headaches that are involved with that, it's just not worth it. Whatever we're not going to have, and you guys don't want at the health center, we'll go out to the dumpsters, and it'll be free for all. So community can come and get it, you guys can take it from the dumpster area, I don't care, but it's really a big headache to have a garage sale or to have people come through the building. I've been advised to not do that. Yes?
Some of the furniture will go to NBO too, correct?
Oh, sure, yeah. Yeah, we'll find it in other, we'll be able to find it throughout the agency, who can use it the best way and get the most use out of it. Yeah, absolutely. Or EBO or, I know there's some still really old furniture in the branches too, so, yeah. Anyone else? Okay, well, thank you very much. Appreciate your time and have a great weekend.